Spice FMKE is where our live streams are this morning, and around the country, 94.4 in Nairobi, 102.5 in Mombasa, 97.7 in Malindi. We're kicking things off this morning, and as we do that, Siti Mugo in the studio with you this morning, Ndruoko, our guest host for the week, Wanjiro Gikonyo, and we're joined by Dr. Mercy Korir. It has been a minute.
I know.
I know. Karibu sana.
Asante sana. It's always a pleasure to be here.
Thank you very much for joining us today as we enter into those conversations. Welcome to our audience on KTM Home as well. Thank you for joining us today. Your radio experience on TV starts now. And as we start this conversation today, we're going to kick it off with today's proverb.
A cutting word is worse than a bowstring. A cut may heal, but the act of the tongue does not. Or the cut of the tongue does not.
I like the way we're all nodding in submission because we agree.
Totally agree. And that is why His Excellency the President needs to be careful with his words.
You're not going to let go of this bone today, are you?
Not only today. Not only today.
Okay.
The good book has something similar, right?
It does. And not only in one instance. Where you read most of it is in the book of Proverbs. Yes, but they are, should we say, complementing sentiments that are expressed elsewhere in that book that you've referred to.
All right. So, from today, for the next 8 weeks, we're going to have conversations about fake information that has been spreading in different sectors in our world. It's very easy for us at many times to listen to something and take it as, gospel truth. Or we hear a little bit of information and we take it as just that's what it is because it's come from what would be a quote unquote reliable source. You're never really sure what it is nowadays of what you hear and whether that is the truth. Fighting fakes, hashtags fighting fakes KE is what we're looking at going into the next a couple of months, and continuing to be very vigilant about asking ourselves the questions about the information that comes to us in whatever form. I mean, I think about all the information you get on WhatsApp groups nowadays, all the information that you get on social media, and somebody sends something through, and because it's come on your phone, or because it's even in the newspaper, or because it's on the news, you take it as truth, and that it is actually the truth. And one of the areas that this has come out very clearly has been COVID. And COVID made its entrance onto the global scene. And I think maybe COVID was not even 3 days old when we started to hear things about a cure, when we started to hear things about a vaccine, when we started to hear things about how individuals on the continent of Africa could not then get and die from COVID. I mean, there is nothing we didn't hear, and it was impossible to actually be able to sift the wheat from the chaff. And so as we look at some of these false narratives that have been spun, I think there are vital things that we need to be able to understand about when information comes. How do we separate it? How do we separate the content and take out what is actually true, disregard it completely, or, take what is good and keep it? And Dr. Mercy Korir is in the room today to help us unpack this and really look at, first of all, off the bat, Dr. What are some of the things we heard about COVID that we can now begin to debunk in terms of myths?
Oh no, there are very many of them. I think I lost track. But I think one of the ones that comes top of my head when you talked about treatment. Remember at the very beginning we were told, hydroxychloroquine could treat COVID. We even had people swearing to be doctors, giving testimonials about how it worked. And we had people buying hydroxychloroquine off the shelves. But some suffered toxicity from the medicine. Some died because of the toxicity of the medicine, but it didn't treat COVID, it didn't prevent them from getting COVID. So I think that is one of the ones that really got proven over time that it doesn't work. We still have others in terms of treatment that people are still using. And I see when somebody's diagnosed of COVID, they're given a battery of treatments, including some antibiotics, which actually do not work. And if you check, the WHO has actually advised that people should not use antibiotics for the treatment of COVID. But you still get, unfortunately, that medics, doctors, and other clinical officers and other healthcare workers prescribing these antibiotics for people who have COVID, and it doesn't really help. What does help really is, just managing the symptoms around the disease, if it's a fever, if it's a cough, but really there is no treatment that you can say you can be given and it treats COVID. The other one was that, COVID does not affect Africans. I think that one has long been debunked by how we are seeing the continent suffering from COVID. And we've seen it even here in Kenya. We have had a third wave. We are easing into a fourth wave that experts are predicting may actually be longer, last longer for a longer duration and more lethal than the ones we've had. So all of these things really are being debunked, are being, proven otherwise as time goes by. The one on the vaccines, which I think vaccines is critical conversation right now when you're talking about COVID. It's still work in progress. I mean, we're all learning as we go along. I usually say this vaccination exercise across the world is like a very big clinical trial, because you just did from a few thousands of people, and then you started vaccinating the whole world with the vaccines that had already shown some promise. And so when we hear about clotting, it's been proven, but it's rare that people will get that kind of clotting. So we're getting, to learn along the way when it comes to the vaccines. So some of the information about the vaccines is still work in progress. But I think the bottom line with the vaccinations is that, the benefits far outweigh the risks. Yesterday, for example, the UK announced for the first time since the pandemic, they did not record any death from COVID-19. They've seen their numbers reducing in terms of people who get COVID-19, people who've been admitted. Their care homes had been really affected by COVID. But what we are seeing now is that the numbers of people the elderly, the people who are vulnerable, who are in nursing homes, who are getting COVID have actually gone down, and therefore their numbers have really gone down. So over time, we are seeing that actually vaccinations really are working towards containing the pandemic.
I mean, we're fighting fake information. I mean, you as the Group Health and Science Editor for the Standard Group, you're looking at stories that are coming in from a medical perspective. Because look, if your grandmother tells you, that they have a long time solution, for example, to treating a cold and a flu, and somebody comes out and says, look, the symptoms of this thing are like a cold and a flu. Therein, there is fake information there, and it's flying. You have ginger and lemon flying off the shelves across the world, right? In the markets, people are buying it in huge amounts. So here you are dealing with the medical and the scientific side of things, and then sharing news and information. How then is this news and information supposed to be spread when people have cultural, traditional beliefs about how they have practiced health?
I think the thing here was, are these traditional beliefs, cultural practices harmful? If no, then there's no harm of people going ahead and, doing whatever it is that they were doing. Because you see, part of healing and part of treatment is also psychological. Sometimes somebody may take a whole concoction of, lemon and ginger, and they feel better. Yet it's because they've told their mind that, this thing is actually helping me. So if it is not harmful, for example, ginger, lemon, they are known to be immune boosters, then there's no problem with that. Where we draw the line is when what you're going to do is going to cause you more harm than good. For example, now when you're talking about taking hydroxychloroquine, taking the antibiotics because of the risk of antibiotic resistance, or any other concoctions that may cause you harm, then we draw the line there. But if adding ginger to your tea is going to make you feel like you have beat COVID, why not?
But you see, what is equally confusing when you are talking about COVID is that this is a new disease. New. Even those who claim to understand it only understand what they understand at that particular point in time. And there's a whole world out there that they don't understand. And then it is a disease that has not only captured the attention, but the lives of everyone on this planet. So you throw in belief systems that people have and with the diversity of humanity, throw in what is already understood by medical science, and then throw in the desperation that it brings about because it affects livelihoods simply because it prevents you from going about your business in the way that you are accustomed to. Now, wouldn't you say this is a genuine breeding ground for even more misunderstanding and more myth creation than anything else that we've actually known?
Most definitely. Most definitely. And if there's anything we've learned is that over the last 1 year, COVID has been ripe fodder for fake news and information. And as Ndu said, on social media particularly, because this disease has come at a time when we are very accessible on social media, be it on the WhatsApp groups, especially those who are very toxic, if you ask me, because people send forward and then it's written by Dr. So-and-so.
Right.
So the moment you see Dr. So-and-so, you think, this is legit. Yet it's just some made up name when you actually go back and fact check. So it's been ripe. It's been a petri dish of all of this, fake information, because one, people do not understand. Even the scientists who are supposed to understand do not understand, and we all have been learning. So anything that was put out there, people were believing it. Remember when all of these treatments came out, WHO had to actually do large clinical trial to test if these treatments actually work, from the hydroxychloroquine, from the ARVs, from use of, the steroids. They actually had to test because we don't know. If somebody has said it works and people kind of think it works, then the best thing was to test this out. But there are things that we know definitely cause more harm than good. And if we know for sure this will harm people, then there's no point of venturing into that. But if we know it's going to cause some harm or it's going to cause some benefit, then it's worth, trying to do something about it.
Yeah, can I jump in and ask, at the outset, of course, it was a big shock. And one of the areas where there was a big gap was the community health system, which it was very heartening to hear the Minister of Health. I know AMREF leadership has also been very active, and a bill was passed to strengthen the community health system, which is also supposed to do the sensitization. If it's operational, then you've got this system that always does sensitization. Between the outbreak and now, have you seen an improvement in the community health system and in the sensitization role that they are playing in sending out information? You smile,
Yeah.
which is not very encouraging.
Because, every time I'm in the situation room, it's like we revisit the same things we were talking about last year. There's been not much improvement, unfortunately, when it comes to strengthening our community health system. This virus came at a time, or rather found us with our weak health systems. And we've seen that much as our leadership will come and say, we have set aside X number of beds. We have done all of these things. It just ends up being, speaking to the public gallery. But when you come to really on the ground, nothing much has happened, because I would have expected that we would have increased the number of community health care workers and community health volunteers that we had before to handle COVID. Because remember, COVID is here, yes, but we still have other diseases. Mothers still have to deliver. We still have to do childhood vaccinations and all of these other things. But we didn't increase that capacity in the rate and quantity that you would expect, considering this was a global pandemic. So we are still struggling to, sensitize people. We're still struggling to pass the information. Everyone right now has an idea of what is happening, what is COVID. But you'll go to some areas and you'll still find physical distancing is a myth. Wearing of masks is still a myth. People are still doing gatherings. At a time when we've not contained the disease. So it found us at a time when our health systems are weak. And unfortunately, we did not work hard enough
To strengthen them.
to strengthen that in a rate that, beats the virus. Unfortunately, we're always trailing and running after the
But
virus.
So after the panic and the emergency, government has taken its foot off the pedal and is back to business as usual.
I would think so in a way, and maybe because remember the predictions and what Tundu was talking about was that this thing, when it comes to Africa, we will not survive. It will wipe us.
Decimated.
And then when it came, we actually were able to manage, and we saw that we could actually handle this thing. So over time, and that's why we're seeing that our waves are getting worse and worse. People are relaxing a little bit more than they were 1 year ago. So while people in the same time last year were, keeping distance, not going into gatherings, being very strict about, keeping COVID away. Right now, people are like, no, even if it comes, I think I'll manage it.
But ask yourself
Unfortunately.
this simple question. Even countries that had vibrant, strong, well-managed health system couldn't cope. I mean, this particular disease didn't really care for wonderful health systems. It didn't seem to care for even
as?
preparedness, because how are you going to prepare for it?
Such as which system had a good health, which country had a good health system and a good response system that didn't cope?
Oh,
Because
no.
India has an excellent.
No.
Now we've realized
I'm not talking about
India
India.
doesn't have an excellent health
In
system.
the
I'm not
public
talking-
health,
I'm
the
not-
public health system in
I'm not
India
talking-
is.
I'm not talking about
It's
India.
not that good.
Yeah.
But we,
When every nation on this planet that is called the first world struggled with
Struggled.
this disease terribly.
yeah, struggled, but a good response with a good health system enabled them to cope better. The point is, it's a pandemic. It's going to have dire consequences. But to say that, irrespective, everyone will be negative, or every country.
Actually, Wanjiro,
a good response.
it is true. This disease
Mitigates.
caught everybody unawares, and it really struck everybody. There was no country that could say they had a handle on it
Had handled it
when it
well.
first hit them. No one had a handle on it.
I think the point I'm making is that if we should not then say that the countries that didn't respond, I think it's the point we were making earlier. A good response reduces the impact. And what we are saying is that what Mercy is telling us is that after a fast, good, relatively good initial response, government has taken its foot off the pedal because there is the impact was not as severe as initially
As
thought.
predicted, yeah.
And so now we are more vulnerable. Possibly the waves, that's why the waves are getting worse.
Yeah, we are
Because
most vulnerable, actually, right?
we are
But
not
you
as
see-
keen as we should be.
But you see, Wanjiro, the issue here is not what even the government does. COVID and the preventative measures, yes, the government will issue edicts. But the bulk of what needs to be done to stay safe lies with us, not the government. That really is the heart of
There's
the
a
matter.
response.
Yes.
I don't.
True. There's an element of truth to that, that we have some sense of responsibility.
No, we have a huge sense of
True,
responsibility.
but remember, this virus is already here.
Yes.
So what happens to people who would need healthcare, for example, that you have unfortunately gotten the disease and you need to be hospitalized, you need to be on oxygen, you need to be on treatment for diabetes or hypertension, because what you're seeing is that, for example, people with diabetes, their sugars go haywire.
Right.
What happens to those people? Because those are the people that we are losing, who we should otherwise not lose. If you look at, and I was looking at this data yesterday, there are some counties in the country which are actually having a higher death rate from COVID than the national average. So you find that they have about 5%. And the question I was asking is, why these particular counties? And so when you look at those particular counties, it's because their healthcare system, availability of oxygen, for example, something that should be in every hospital, is not there. So somebody is dying because they could not access oxygen, not because of the disease, because the oxygen would have kept them for much longer. So their chances of surviving would have been higher. So there is both sides have responsibility. But for me, the biggest one should be government, because at the point where you need care, it should be available to you.
Yes, that should be the case. But remember, the disease finds you if you go towards it. You know you should wash your hands. You know you should keep distance. But we're going to say, but what do you do? I must crowd in matatus. if you go to our rural areas, if you go to the areas that are now experiencing this prevalence, social distancing was not considered. These basics that we talk about,
Not happening.
No one gave a hoot.
Where you tuned in from around the country, Spice FM KE is on our live stream today on YouTube and Twitter. We're continuing in this the situation today, fighting fakes, fake news, fake information that has come out, and we're kicking off that conversation today. Over the next couple of months, is starting off with COVID and seeing a lot of the myths that came out as a result of the entrance of COVID on the global scene. And then we were inundated by stories. And even as we continue with the conversation in the room today, CT Muga, Ndrioko, Wanjiro Gikonyo, and Standard Group Health and Science Editor, Dr. Mercy Korir. How do you know? I think that's just with all the things that we've talked about. If I receive a forward, I receive an email, somebody whispers something into my ear. How do I know that this is fake news? How do I know that it is fake health information? And how do I know then what is the truth?
I think by the time you're getting a forward, it means you have a smartphone. And nowadays, all of this information is within reach. I mean, you can get to, especially now, in this era where even if you Google anything, it can take you to sites that, are propagating that fake news. But the site, WHO site, is a place where you can get credible information. CDC sites, now we have Africa CDC, we have the US CDC sites. Those are places where you can get information. And if you're in the medical profession, there are now specific medical sites where you can verify and check some of this information. But for the public, your WHO and CDC sites and your own Ministry of Health site would be good sources of information or good places to verify that information, because if you just to randomly Google, and I have done this myself, it takes you to sites that really look credible, that is branded Dr. So and so, or according to I don't know which study, according to research, those very nice words that are meant to convince you that the information is credible. But I think limiting yourself, especially now, to sites that are proven, that by the time information is put out there, it's been verified, then I think that would go a long way in helping to just know that this information is either fake or true. The other bit is that I think every one of us, for those that may not have the privilege of a smartphone, every one of us knows a doctor or healthcare provider. You can also just check in on them and find out, is this really credible? Is it something worth believing in? Is it something that I should take seriously? And they'll be able to tell you whether to believe that or not. And if they're not sure themselves, they should be able to now even verify from the medical sites where some of this research is done, some of this data is published, so that they're able to tell you whether it is credible information or not. Unfortunately, and that's one of the things that I've come to see, is that, at the end of the day, even we doctors are human. Sometimes we also fall prey to fake news and fake information. So it's also just good to also now double check, like what you do in the newsroom, because Dr. So-and-so said A, B, C, and D, you just have to also now just check with somebody else and maybe a third opinion, so that you can corroborate what you're getting. I remember somewhere during COVID-19 and when the vaccination started, we had the Catholic Doctors Association, telling people about the vaccines and not take the vaccines. And, when they say doctors, you actually believe it. So it's also now just good to know what source of information.
They actually were doctors.
And that story really ended on a sad note.
No, that was a very tragic.
And yet,
from COVID,
right?
The chair and his brother.
And yet, if you were to ask how many people who subscribe to the Catholic faith who are doctors, who are not in that particular association, you'd find very many.
There are more than those in the association.
So, where the fake news is when you say Catholic doctors. That's the fake news. Because it isn't. It is this association, and with specific members who are medical doctors and who also happen to be Catholic.
Who are known to be anti-vaxxers for a very, very long time. They've opposed all vaccines known.
Yes.
So
I think also when you're dealing with decentralized information, this is a decentralized and digital information, where you can't really say the Catholic doctors are fake, because they're a lobby group, and they're a legitimate lobby group, and their position is legitimate if misadvised, because, like you say, they're anti-vaxxers. It's their policy. So how does the citizen then discern? So with the proliferation of information and points of information, there's a skill that we all need to learn, all of us, which is information literacy. So it's emerged as something that people need to be taught, because you can't always, you will not always receive the correct information. So you need to learn how to sift through yourself. Information literacy, critical thinking, and we're not the only ones who are prey to the misinformation. Look at the States with their major kind of education system. You still have a lot of misinformation being propagated. So the issue of information literacy, critical thinking, I think needs to be taught. But then again, it can only go so far. Because if somebody's an anti-vaxxer and they hold to that, I don't know how you break through that.
I mean, there's a whole thing, because we also know that there are some anti-vaxxers who have vaccinated their whole family and their children. So they're doing it for the public relations and all of this. I mean, we get into a whole, it's a business. We get into a whole other fake news arena when we even start to go into that. But I do remember on the onset of COVID, in this very room, one of the things that we said needed to happen was that clear, concise communication needed to come from a central point in terms of what people needed to know, what they needed to do, and how they needed to do it. And we liken this to the communication that came during, and maybe it was quite some time after the onset of HIV, but after some time it was very clear what HIV was, what you needed to do, how you needed to do it. It was very clear, and even until today we still remember, because it was ingrained in our minds. Now, looking at fake news that has come out as a result of what has happened with COVID, like we heard the former president of the United States saying something as ridiculous as everybody can have a tot of bleach, for example, and you'll be fine. And Americans went out and bought bleach, and some of them were admitted in hospital.
Yep.
Right? If we're coming back to this side of the pond, the two people you listen to before everything else are your doctor and your priest. And then we have this information coming from people that ordinarily we would take advice from. So how do you see it? Clearly from a medical and scientific point of view, somebody who you would trust normally is telling you this thing. You have gone through and you've done your Google and you find that something else. What do you do and how do you make that decision?
I think that will put a lay person between a rock and a hard place, because here is, and I'm thinking of the Catholic doctors. You're Catholic, so church, doctor, credible information. And so this is where I say you counter check. I mean, it doesn't harm to get a second and a third and a fourth opinion from somebody else. It does not harm, because this will help you, it will help you avoid a lot of issues and, maybe contracting COVID and dying from COVID. So it doesn't help to get as many opinions as possible. And then what Wanjiru was talking about, critical thinking. I mean, some things when you read look too good to be true. You should be able to actually just think about it. Or if everyone else is saying opposite of this, why is this particular person, let's say, opposing the vaccines? Just think about it. If everyone else is saying do it, why are only a few voices saying don't do it? And that helps in actually now just questioning the kind of information that you're getting from some of these sources. And the other thing is, and I just want to go back to what you're saying, critical thinking. When you think about some of this information, if and unless it is verified, you don't need to forward. You don't need to share. I mean, if you do not need to, because, and especially, thank God nowadays, WhatsApp does forwarded many times that tag. It's been like that. Just think about it. Why is that the case? Because remember, fake news flies faster than truth.
Consider most people who purvey fake news don't know it's fake.
That's why we're saying people need to think about the information that they're reading.
Actually, I'm taking this discussion further, and I'm saying that when you look at COVID stands out because of what it is and what it's doing to us, and the enormous impact it's having. But just pause and put COVID aside and just look at our everyday lives and look at our systems of understanding things, belief systems, whatever system you want to call it. Those are tinted glasses through which we look at life every day. So we are predisposed to receiving news. What later becomes fake doesn't start as fake. It starts with what we
an element
receive.
of truth.
Yes, and what within these systems that we look through things or with has accepted and received. Now, whether you want to make it a political discussion, whether you want to make it a social, whatever, cultural, but we are already predisposed. For instance, we talk about Catholic doctors, blanket statement. Not true, because it is just that group of people who happen to be anti-vaxxers and also happen to subscribe to the Catholic faith, and not all doctors who
Are
are
Catholics?
yes.
Anti-vaxxers.
Another fake proposition that we entertain is a statement of the government is, okay? For instance, the government can't wash my hands for me. The government can't social distance for me. That is me. I'm supposed to do it.
The government cannot wear my mask.
It won't wear a mask, and it can't even if it wants to. But the government has a duty to ensure we have vaccines for everyone, because we know vaccines will give you an excellent fighting chance against the COVID. The government can set curfew hours. The government can try and enforce those curfew hours. But the government is not going to tell me and follow me everywhere I go, because it can't. It is me who should decide I am actually going to do certain things.
Okay,
But
as we continue with that conversation, just to hear from you guys, 0719-012-600, what are some incidences that you've been faced with? What is some information that has come to you that you're not really sure? Is this the truth or is it fake? 0719-012-600. I'd like to hear from you today as we go along with that.
CT, are you then saying that the government, you seem to be, no, are you saying the government does not have a responsibility to communicate? And the point that Mercy made, a central point of communication, and then should they not ensure that that communication and dissemination of information follows good principles for behavior change? Point that Ndu made, that the government figured out when you have a stigmatized, a disease that has a lot of stigma attached, human behavior will then be very irrational, especially when there are also economic considerations. Because people are saying, I'm not going to social distance, I'm not going to do all this. Why? Because I must survive. In this case, the responsibility of government is to have consistent central communication that builds in principles of behavior change, recognizing the irrational behavior that they're dealing with.
What you're saying is the myth, because this centralized position from which the government speaks, if there is no system that guarantees it is cascaded through the health system to community health workers who understand how to communicate these sophisticated things to the community, complete waste of time. You can talk as much as you like every day centrally, it'll go nowhere.
Before Dr. Mercy addresses some of those things, let's hear from Dr. Majan in Mombasa. Good morning, Dr.
Good morning. Thank you very much, Situation Room.
Asante.
I'm glad that you brought this topic today. The other thing that we have to realize is the politicization of the COVID-19 treatment and information. One, you can have, a case in point will be possibly, India, and whereby, the ones in political leadership will kind of cosmetically make, social distancing to be horrible, and other things we know are measures to contain this. And then there are also politicization. You have these wars about even the vaccines. Indeed, even the WHO had to look and do scientific studies about all the vaccines that are available. some people will now start saying, no, we don't like the Chinese vaccine, we don't like the Russian vaccine, and they'll think that there's some politicization about it, and therefore there'll be a point about spreading of fake news.
Yeah.
The unfortunate thing about the Catholic doctors, particularly they have an advocacy role, and of course role, and perhaps that is important. But then one have got to sift. The very unfortunate thing about it, one now has got to read between the lines
and sift the information.
Pope Francis himself took the vaccine, and the Pope is, in the Catholic leadership, he's got a lot of advisors, medical advisors who really must have advised him. I think this advocacy role of the Catholic doctors was kind of misplaced in a way. But also, when we are looking at a central source of information, let's say particularly, the Ministry of Health, if the country's leadership kind of muzzles some certain information, and this is what happened, in our neighbors. Yeah, it will cascade down to all to the Ministry of Health, to the provinces and everybody. And if you suppose you open the website of that government or the Ministry of Health, they'll not be giving the right information about COVID-19. They'll be giving information that is palatable to the country's leadership.
Thank you,
Those
Dr.
are some of the cases.
Thanks for your comments this morning.
Much.
Thank you so much. Let's hear from Ed Gitonga in Nyeri. Good morning, Ed.
Morning to you. How are you doing?
Very well, thank you. How are you, sir?
I'm doing good. Now, here's the question I have. No, for example, I was for AstraZeneca. I wanted to go for the jab.
Yeah. Yes, we can't. Okay, Ed, we can't hear you very well. So, maybe we can try calling you back, and then we can hear what it is you're saying, right? All right, let's hear from John in Elbergen. John, good morning. Okay. Hello, John. Hello, John. Good morning.
Morning. How are you?
Very well, sir. How are you?
Fine.
Yes.
Normally, I agree with the Muga on many things, but this issue of telling us that it is, of course, there is an individual responsibility, but to me, the biggest responsibility goes to the government. When you are dealing with a pandemic, it is usually a government responsibility, not an individual responsibility.
John, Kweli.
And I can give you an example, Muga. The only two countries that I know that tried the individual responsibility failed miserably, and that is US and Sweden. All the other countries that have done very well, this thing has been driven by the government 100%.
Are you saying that the compliance of the citizenry did not play a role in this?
No.
It does, but the government must take the lead. You cannot say now it is individual. And Dr. will tell you there. Sometimes those people who get COVID, it's not that they don't wash their hands. It's not that they don't put their mask.
Okay, I'm going to backtrack here. Did I say that the government has no role?
No, what you are trying to say is that the individual has more role than the government.
No. I actually didn't say that. I said the individual has a role and it must be recognized. And the fake news is that it's only the government that has a role. That's what I said.
No, that's not what you said. You qualified now, but you're welcome.
But surely, isn't that what I said?
That's done. Okay, let's give John a
Let me ask Dr. a question.
Yes.
And this one, because now the government is also not helping when it comes to or the medical fraternity is also not helping when it comes to fake news. For example, initially we were told that you cannot mix the vaccine.
Yes.
Now they are telling us you can actually mix the vaccine,
which is fake.
No, it's not. I don't know if it's fake.
No. I'm actually asking the question: which is fake? Is it that you can have the first dose and stay with it for some time? Because this is what we've heard coming from the Ministry of Health, that we can push up the period up to 16 weeks.
So I think what John is asking is different. So there's a bit about the duration, where for AstraZeneca particularly, you could wait up to a maximum of 12 weeks before you get your second dose, because it showed that the longer the duration of wait, the higher the response, the higher you mount a response. But I think what John is asking is about if you get AstraZeneca as your first dose And now
you
we don't
finish
have
with
it.
Johnson?
Can you finish with
Can you get
Johnson and
Johnson?
Johnson or any other one? And I was seeing actually last evening, Canada was saying you can actually mix the vaccines. And this is what I was saying earlier on, that we've only had these vaccines for now 5 months, 6 months, going to the 6th month. We are still learning along the way. What I was saying is like a very big clinical trial across the whole world, where we are learning as you go along. Remember, initially, for example, for Pfizer, it was only for people above 18 years. Then the Pfizer and the US went to check on adolescents. Can we vaccinate people between 12 and 16 years? And they did the studies and they're like, okay, yeah, I think it's safe to vaccinate. So we are learning along the way. And for me, if it is approved that you can mix the vaccines, the better, because it means then we'll have more people accessing the vaccines. But then maybe the politics, what Dr. was it Majan was talking about?
Yes.
There's a lot of politics with the vaccine in that, and what you're seeing that the richer countries have vaccines, they are trying to entice, kubembeleza watu wao to take the vaccines, yet in the low and middle income countries where we need the vaccines, we don't have vaccines. We have actually
But Mercy,
delayed.
we also need to also tell our audience and people who listen that all these vaccines have been given approval for emergency use.
Yes.
Okay, which means many of these vaccines are yet, and you alluded to it, are still at trial stage. And emergency use means there is more good that will be gotten out of it than harm. But as it is used by more and more people, they get an opportunity to see how it actually interacts with a large population and with the diversity of population. Yes.
You have explained it.
Yeah,
And so we are learning along
the way.
as you said.
Can I
Yeah.
also pick up on the issue
At
of
least for
politics?
vaccines.
Yes, it's
Yeah,
yes.
but even the COVID itself.
Yes.
Really. We're
So
still
then it's
learning,
easy for fake news to come, especially when you're in a process of continuous learning.
which is what City was talking about, that because this is a new disease,
yeah.
anything goes. So that's why we're having now this conversation. How do you know that what you have received or what you're hearing is actually the truth and not the fake information which we expect from this situation that we are in as a world?
On the issue of politics, what's your view of government stopping private vendors from importing and selling the vaccine? Because in the testing, it worked. Those who wanted to go public went public. Those who wanted to pay 10,000 shillings for their test did that. What's your take on that?
I think, Dr. You give us your take on that, but right now we have to take a break and move over from KTN Home for those who are in that audience to come over to Spice FM. Thank you for our audience on KTN. Don't forget, the conversation continues on Spice FM KE on YouTube and Twitter, 94.4 in Nairobi, 102.5 in Kisumu. We connect again on this platform tomorrow, but for now, we're taking a break.
This is the Situation Room, the only way to start your day. Spice up your life.
You know, when you see someone being jailed, a governor or two or someone who stole, then people will fear. Because our problem is not the borrowing, it's the stealing.
We've become actually a nation of thieves. The only thing we lack is an opportunity to steal.
The guys who quote the Bible and say, I'm a Christian and all that, and you know they're thieves. Return what you have stolen 4 times. If you know that you have property or anything that you have stolen, just return and say, my God does not allow me to hold stolen things.
We are also a reflection of you, because you elect us. You know, we don't get into our office by ourselves. We are a reflection of the people who elect us.
We don't want to go to the streets. We have a constitution that enables us to assert our will.
When the legislature are now being taken as hostage by the executive for whatever reason, we are now bound by what they want us to do.
This is just outside the realms of reality.
We have impunity written into the DNA of our political class.
How old were you when you learned that Jeshi la Wokovu is Jeshi la Wokovu?
I can't say it very well.
And everyone knows. Okay.
This is the Situation Room, the only way to start your day.
Are you ready? Okay.
Spice FM. Mature, intelligent talk every morning. Spice up yourself. things done right. 94.4 Spice FM, Nairobi.
We're having the fake news conversation, as you will, for the next couple of months. And we've had Dr. Mercy Korir in the studio joining us. And as we wrap up this conversation, asking ourselves this question, those who could pay, as Wanjiro was asking, those who could pay, why wasn't government allowing? Was there another story therein that, a myth that needed to be uncovered? And even as we do that, then what are some things we ought to remember from the medical point of view for COVID in terms of wrong information?
So on the issue of the private access to vaccines, my own personal opinion is that, the vaccination exercise is a government responsibility. It's a pandemic. We are all affected. And unfortunately, as a country, we are used to, if you have money, you can access healthcare. And we saw this even during COVID, where, if you could afford to test, you could test. If you couldn't afford, then you didn't know what your status was. And that was the direction in which we are going to go if the vaccinations were going to be privatized, or if people are going to get private access to vaccines. Then you create that inequity. You create a bigger divide between the haves and the have-nots. So vaccination, to me, remains purely a government responsibility. That's why you and I pay taxes, so that in a situation like this, that money should be able to come and help us. I don't mind if government spent billions of shillings to buy and procure vaccines for all of us to be vaccinated against this pandemic. But for private individuals to still go to their pockets and, pay even if they can, then it just creates unnecessary divisions. And that is unfortunately what we're seeing in the country right now, where if you have money, you can access healthcare. But unfortunately, that comes to an end at some point. And you've seen that when people needed to access ICU, for example, and all of them are full. You have money, but there's no bed.
Right.
So we need to really change this notion of, that money buys everything. Health should be a public good. Everyone should have access to good healthcare. Now, when it comes to COVID...
In 10 seconds, Dr.
Yes. I think what we need to remember is that this disease is actually here. 1. 2, vaccines have been shown to give us more benefit than the risks associated with it. And when it comes to fake news, if it seems too good to be true, just verify. Just counter check. Call somebody. And you have the websites, Ministry of Health, WHO, CDCs. You can also check for information there.
Always a pleasure to have you in the room with us, Dr. Mercy Korir. Thank you so much. And we hope that as we continue to ingest this information, we will be ingesting the truth. It's now 8 o'clock.